Anthony Fosachek from OhioDaily blog. I'm here with Ohio Secretary of State Jennifer Brunner. We just got out of the Barack Obama Healthcare Town Hall.
And we are standing on the track at Shaker Heights High School.
We probably won't run any right now. It was very humid, very hot in the building. 1,600 people here for the town hall. It went about 45 minutes. President Obama talked briefly, gave some introductory remarks, and then went right into the questions from the audience. What were your impressions?
I think that he answered a lot of questions that everyday Americans had about health care. There are a great number of people who have health care, but the kinds of things that he heard questions about, that he talked about, are things that people experience in their everyday lives. I know myself, when I hear stories about people whose pre-existing conditions exclude them from coverage, or young people, I have 3 kids in their 20s, who we really had to struggle to make sure we keep them with health care. If they leave school and they have a job, then their job needs to have health care. And these are the kinds of things that people think about. And I think he impressed upon people the fact that the reason our wages have been flat for a number of years is because employers have had to make up what they could be paying workers in higher wages, in higher health insurance premiums, and then at the same time the insurance companies are working against us instead of using the insurance to actually cover things, because their costs are getting higher. Then they're actually cutting the ability of people to get the health care that they need, even when they have health insurance.
This is likely going to a vote in the fall, or hopefully even in August. It may be signed into law by the time you, hopefully, by the time you would make it to the U.S. Senate, should you win a primary in the general. What would be the next step in health care, do you think, that might not make it through this cut, that you feel like probably be the new health care priority if and when you are elected to the Senate?
I think there are such massive changes needed that this will be the first level, and then as things are tried, whether it's in a pilot project or whether it's the first increment, because he talked about the changes being phased in, there'll need to be tweaks, and there'll need to be adjustments along the way. And there will be the need for a senator who stays in touch with the people who are being affected by this and can translate that into good quality public policy that will have the desired effect that people want as these changes take place.
Let me throw a curveball at you. 2 of the Ohio representatives, Zach Space, Charlie Wilson, both members of the Blue Dog Democrats, calling for the healthcare proposal discussion to be slowed down quite a bit. What are your thoughts on that?
I'm concerned about that, because if you understand just the way politics works, and the president clearly does, as time goes on, it will become more and more difficult, as he put it, more and more controversial to be taking bold measures. And so it needs to be done quickly, or there'll be this malaise that will set in, and then the forces that simply want to slow it down for political purposes will start to gain a foothold. We need to stake it out, make the changes now, as the president said, implement them gently, gradually, deliberately over time, but the ideas have to be put in place now.
Ohio Secretary of State Jennifer Brunner, she's a candidate for the United States Senate, and thank you for your time.
Thank you, Anthony.
Thank you.
You too.
Thank you.